So I want to jump for just a couple of minutes to testing because it's so nebulous. So I don't want to spend that much time. I really want to then get to the schools. So
Sure.
a couple of words about testing. I know it's in the book on, testing.
Absolutely. Quickly, I also want to ask you if that's you playing piano in your intro, which I really hope it is.
It is.
Yeah.
It's,
That's so
yeah,
cool.
it's the Van
So
Gogh theme. Yeah.
there you go. There are broadly two forms of tests that anybody can get. The first one is called an antigen test, and that's the one where they stick a swab up your nose and get the back of your nose and the back of your throat. That's the one that tells you if you actually have virus in your system right now. One of the other ways that we're working really hard to get is a saliva one, where you either chew a little pad and it gets your saliva, or you just literally suck some out and look again for antigen, which means actual virus is happening in your body. The other kind of testing that we have is called antibody testing, and you actually have to do that with blood. And a lot of times it's just a little prick of blood, although they can do a big blood draw too. That'll tell you whether or not you used to have coronavirus. So did you have COVID in the past? So if you get a test and it's a prick of blood, it will not tell you if you have COVID right now. And the reason that those tests aren't so popular anymore is that there's a lot of different kinds of coronaviruses, because COVID is one of the coronaviruses. Those also cause the common cold. So kids get about 12 coronaviruses a year. And at the beginning of this outbreak, we thought that kids didn't get sick from coronavirus because they already had coronavirus in them, because so many kids get common colds. It may still be part of why kids don't show as many symptoms as adults do, but that's kind of another topic. But so the antibody test with the prick of blood isn't really going to give you very much information. But the antigen test that's in your nose, that'll tell you whether or not you actually have COVID in your system right now. So that's the better one for this.
Right.
There's two kinds of that. One is the rapid one that you find out in a couple of hours, and that's fairly accurate. And then the longer acting one can take some days. The good news, I guess, sort of, is that if your coronavirus is positive, in other words, if it shows that you have coronavirus, it's almost certainly correct. If your coronavirus test is negative and shows that you don't have it, we're not so sure that that's correct. And a lot of times people have to get tested again. So don't discount it. If you have a lot of symptoms of COVID, but your test is negative, you probably actually have COVID. But if it's a positive test, you probably really do have COVID.
Important to know. In the book, there's a whole chapter on taking care of someone with COVID. I'm going to ask people to read the book because you may absolutely be in that position. In the book, it's about work. How do we go to work? We spoke a little bit about that. But right now, schools are about to start. Let's spend a few minutes just really talking about that, because it is such an anxiety-provoking thing for so many people. So many people are trying to figure out what to do. What do you talk about in the schools?
Annie, you want to mention some of the things we talk about with schools?
Well, we cover a lot. And I do want to preface this by saying that none of this is suggesting that people should or should not go to school. That is definitely a decision for you as an individual or a parent, or your school district, or whatever governing body makes those policy decisions. We're just here providing the information that, should you be in that situation, might be helpful for you. And it's our tips and tricks. We're talking about how to maintain social distancing when you're in crowded places like cafeterias and classrooms. We're talking about how to get kids to help remember to wash their hands, and all kinds of different preparatory things that teachers can do to try and just make their classrooms as safe as possible. And I'll let Anne talk about some more of the specifics. But
well, there's things like, it's kind of like becoming a detective, because there are a lot of sleuthing things that you can do to protect yourself in these environments. Like, take a look at the ventilation system, and don't put kids right in the middle of a downdraft, because do we know where that air is coming from? What if it's coming from the other side of the room and there's somebody who's got coronavirus there? So take a look at your ventilation system, make sure that you don't set kids underneath that. Isn't that interesting? Another thing that you can do is use the power of the sun, because we know for sure that sun actually decontaminates coronavirus. So leave your windows open, leave the shades up so that indirect sunlight can come into the room. The brighter the room is, the safer it's going to be. That's a really important thing. Try to keep the doors to your room open as well as the windows. And so you sort of have a constant ventilation. But if you have that, move the kids around so you don't have somebody staying in the same stream the whole time. The other thing that we've learned is that coronavirus spreads faster through people's mouths with increased volume. So that's going to be really tough for teachers, right? I mean, first of all, they have to wear a face mask, and then they also have to talk to these kids who are talking to each other. It's really difficult. So we advocate the schools should give microphones if you possibly can, any kind of speaker situation, which that already is part of the requirements for any kind of special ed situation. So public schools should have the ability to accommodate the need for speakers for teachers. So that would be another great simple thing to do.
So one real quick thing before we go to our two final questions, and this applies both work and school. Person comes home from work or school. What should the people do at home? Is there a protocol people should follow?
I believe, and we do this at my house, my husband's a doctor, so am I. He works in the ICU and sees COVID patients all day long. It's kind of like a decontamination process. I mean, every doctor that I know, and I realize that's talking about doctors, but if you think about it, people in hospital healthcare workers actually have a much lower rate of getting COVID considering how intensely exposed they are to it. So let's take a page from that book. My husband wears scrubs. He gets home. He literally walks directly into our bathroom, takes them off, puts them in a special bag, and jumps in the shower. We have a little routine. Then he gets to put on his comfortable clothes, and those are his clothes that he stays at home with. So everybody can do that. When I go to the grocery store, I have this windbreaker I put on, and I put it on before I go in the grocery store. I wear it when I'm in the grocery store, and I take it off and ball it up and put it in the bag in my car when I'm done, just in case somebody coughed on my back and I didn't know about it. So we can all do that. Take off your shoes at the door. That's something that is universally accepted in all the rest of the world. When we work in Cambodia, I have to really check my socks because I have to take my shoes off everywhere I go. People don't wear shoes inside. And so that allows you to have more cleanliness. Take off your shoes at the door, leave them there. That's really important to do. So yeah, and then the other thing, Joe, is take a break. Oh my gosh, it's exhausting. It's so hard to stay safe, be aware of your environment, don't touch your face, wear your mask, talk softly, and still do your homework or do your actual work or go to the grocery store. And I mean, so we just all have to take a break too and relax a little bit.
Yeah, and that's something that leads right into the two rules of the IM. Small changes can have big effects. You don't need to change everything. All four domains interconnect: home, social, biological, and I see how I see myself, how I think other people see me. So, Dr. Ann, let's go for it. What small change can you recommend to our listening audience besides getting the book?
Think about make a plan. How about that? Is that a small change? Make a plan. Make sure you've got a thermometer and some Tylenol and some Advil and your favorite thing to drink and some Kleenexes and a wastebasket in your house someplace so that if someone were to get sick, you wouldn't have to run around and scramble to figure out what to do. And then when you've made that plan, you're going to feel a little bit more confident because you're going to know what to do. And so that allows us to feel like we have some control over this situation. And I think that that's incredibly important.
Annie, do you want to add anything to that? You've got a few seconds.
Yeah, definitely. I mean, I think from my end, more of a personal and mindset change that I would recommend is just remember that this isn't going to be forever. You know, we've all got to suck it up and deal with this right now and wear the masks and socially distance and work from home and things that are uncomfortable. But if we do that and we all do it, this will end soon.
Yeah.
Hopefully.
I'm going to just change when. We got to stop in a minute. But Anne, you control no one, you influence everyone. You get to choose. What kind of influence do you want to be? And then we're going to wrap it up.
I want people to know that they can reach out and work together and we don't have to blame each other. We can all get through this together. No blame.
And one more quick time. How do they get the book?
Amazon, Corona Care Handbook. Look it up.
Corona Care Handbook. Here, I'll show you a picture of it. It's orange. We had an amazing illustrator.
Yeah, it's fantastic.
Corona Care Handbook.
One Good Turn, Corona Care Handbook.
You can find it
And
right on our page.
One
Oh,
Good
good.
Turn is incredible. And please donate to it. It's a nonprofit. It's fantastic. It's going to be important. Jen, thanks so much. Guys, we'll see you next week. Bye.
Stretch the kindness, rush with madness. Is it sadness or just a show that